The graphs, they've been adjusted again today. And let me just say, down a little bit, left a little bit, 4 days to the peak in daily deaths in the United States. He is predicting a peak of now, we were up in the 3,000s yesterday, now at 2,100. So the deaths per day are falling, which is amazing news. He has a graph that predicts the total deaths for the epidemic by, say, July 1. By July 1, he's predicting only 60,000 deaths total, which is now in the flu range, a bad flu, let's be fair. And let's congratulate everyone. It's because of the monumental effort the citizens of the United States made. They got up and did what they needed to do. I saw it happen here in California very intensively. In California, the graphs are way down. Let me see if he has his total deaths in California are predicted to be only 1,600. This is in a state of 30 million. And it looks like the projected deaths are going to be around 60 per day at the most in California. And we again, are going to easily meet our resource needs for hospital beds, ICUs. And we've begun to give away our ventilators to other states. And it looks like this country may be able to give away ventilators to other countries that are in need, which would be great. So this is all really good news today. I will tell you the most recent data is we are at, I know that Hopkins is reporting 4,000. This is the COVID tracking. It says 395,000 with 16,000 deaths total. No fun. There's been a terrible, aggressive illness, but we are doing a remarkable job. And the other thing that's really driving this all down that may yet have even more of an effect in the next 3 days is treatments. So where doctors are learning protocols and ways to approach not just the initial illness, the milder forms of the illness, but also the more severe forms where they can block. I'm going to speak to a guy tonight on Fox 11. I'm also going to talk to Dr. Ben Carson about what the Health and Human Services is doing about this. But the other issue is the ability to block the cytokine cascade, that the inflammatory cascade that causes so much devastation when people get really sick. We're going to talk about that. And we're going to talk about other more powerful antiviral agents and what we think are going to be good and effective ways to turn things around. So if indeed hydroxychloroquine is a prophylactic agent, if indeed hydroxychloroquine affects early in the disease, if indeed we have powerful anti-cytokine and antivirals that are working, you may see the death rate come down even further. And that would be amazing, amazing, amazing. And this is the part I didn't see coming was how amazing the United States would be in sort of rising to an occasion when asked by their leaders. And we should be reminded of how we do that. But number two, I did see, and I did predict that the American healthcare system innovates and responds better than anybody on earth. And that is what we're seeing here and what we're going to continue to see in the next few days.